Logistics, other directors and officials here present, and members of the press. We have a briefing for you today. As part of the briefings we do every week, but on this extraordinary note. The Federal Ministry of Health regrettably confirms 5 new cases of coronavirus disease in Nigeria, which occurred within the last 36 hours, bringing the total number of confirmed cases in our country to 8. Of the 5 new positive cases, 3 arrived from the United States, while 2 came from the United Kingdom. We are still collating information on the travelers, but we know that 2 of the 3 from the United States are Nigerian, a mother and her child, making this 6-week-old baby the youngest COVID-19 patient we have. And the 3rd person is an American national who crossed the land border and became the first COVID-19 case who did not arrive by air. The 2 cases from the United Kingdom are Nigerians. A detailed travel history of each person is still being compiled, and contacts are currently being traced to identify persons who have recently been in touch with any one of them. The National Emergency Operations Center, led by the Nigeria Center for Disease Control and supported by partners, is carrying out a response in all the states. The federal government, through the Ministry of Health, is conducting the risk assessment to help to guide decision making. We urge Nigerians not to panic, but to allow experts in the public health space to guide the response in a calculated, scientific manner. False information and rumors to cause fear and panic must be avoided at such times. The COVID-19 cases so far appear to have mild symptoms and are all under treatment. To protect yourselves and your families, I urge everyone again to continue to take care and caution as advised by the Ministry of Health. Government will do the needful to protect citizens' health. The Presidential Task Force for the Control of Coronavirus, COVID-19, has announced the following interventions on the 17th of March and also this morning. First, the prohibition of travel by all public servants. Secondly, the suspension of the visa on arrival policy until further notice. Thirdly, a firm travel advisory to Nigerians against non-essential travel to high-burden countries, especially in view of the number of Nigerians who have arrived from the US and Europe and diagnosed in the past 48 hours with coronavirus infection. Number 4, a requirement that all persons returning from overseas will self-isolate for observation for 14 days, even if they feel very well. The NCDC will disseminate information on the practice of self-isolation. Number 5, a supervised self-isolation, including testing of persons returning from nations with community transmission of more than 1,000 cases cumulatively for 14 days, will be conducted by the Nigeria Center for Disease Control and Port Health Services. Number 6, federal government will restrict entry to Nigeria of persons from the listed high-burden countries with effect from Friday, March 20th, for a period of 4 weeks initially, and subject to review. Number 7, a reminder that citizens maintain hand hygiene and standard respiratory etiquette. The Federal Ministry of Health, through the Nigeria Center of Disease Control, will continue to provide accurate and reliable updates as and when they are available, and we shall take measures to control the spread of infectious disease outbreaks in Nigeria. This is the end of the briefing. We shall take some questions. So we first of all answer the questions given here. The first question is where these cases are located. One of them is located in Ekiti, and the other 4 are located in Lagos, but all of them are being followed up by the state public health officials and supported by the Nigeria Center for Disease Control. Remember, there is an emergency operations center that is in operation and ready to move very quickly to send rapid response teams to support states that may be affected. The second question is about the case in Katsina. I do not have any information on that one. If he has already been, there's a case like that actually in existence, they will know the protocol. The testing of all cases happens in our laboratory here in Abuja, and I'm sure the public health officials will be informed if there's really a case like that. The third one is about the effectiveness. Yes, it is true that the effectiveness is taking place in the night between Friday and Saturday. So it actually, to be quite correct, is midnight, the night from Friday to Saturday. So there is ambiguity there. If one said Friday, the other said Saturday, it's from midnight, in the night from Friday to Saturday, that those restrictions take effect. Everything that the Secretary of Government announced. With respect to the case in Enugu, what was done was to test for coronavirus. That is all. And before it was tested, the patient was in protective isolation. And after the testing, he came out negative and was discharged. We do not know what the underlying illness was because that was not the purpose of the test. We do not know if actually what you are telling us now happened, that anybody passed away. But I think if the family reaches out to the ministry, we can look into it. But we have not, nobody has communicated anything officially to the ministry. But with the testing, they only just took a probe and tested it. Now, with regard to the monitoring of self-isolated persons, I will give the microphone to the Director General of the Nigeria Center for Disease Control very shortly. Whether the cases are new, yes, all these are new cases. Before now, we had 3. We confirmed 1 yesterday, and these 5 were confirmed overnight and validated this morning. And as we promised, we keep you updated with latest news, so as to save you from looking for news elsewhere and getting wrong news. And the next question of procurement, we are not complaining about procurement. No problem with procurement. The procurement is done directly by the agency in charge, that is the Nigeria Center for Disease Control, and they have no difficulty in expending their
thresholds.
Yes. So they are not in any way restricted, and they have not complained, not to my hearing. Now, the Director General of Center for Disease Control will answer about the self-isolation generally, and then the supervised self-isolation.
And the incentive as results.
Thank you, Honorable Minister. So, what has changed from the announcement of the Secretary of the Federal Government of Nigeria is that we're advising all returning passengers to Nigeria to isolate, irrespective of where you're coming from for 2 weeks. In addition to that, if you're coming back from one of the 13 high incidence countries, 13 countries that have 1,000 cases or more, we will carry out what we call supervised isolation. That means we follow up with each of them every day for 14 days. So once you come in, you're coming from one of those 13 countries, you undergo what is called secondary screening at the airport. Colleagues from Department of Port Health Services will get detailed information from you. Once we have that information, somebody calls each of those people every day to see if they're well. If they have symptoms, we then send someone to collect a sample. In addition to that, we have just developed guidance on what self-isolation actually means, so that we can hand out this to people coming in and not just say you are going to do self-isolation. We tell them step by step what does self-isolation mean. We don't have a policy at the moment of blanket support for everyone that is being asked to self-isolate. But in specific cases where there have been appeals for support, this happened in Ogun State with the first case, the company provided extra accommodation to make that process easier. And where this is needed, we will support. In every case, we do a risk assessment. In some homes, they are unable to do self-isolation because everybody is living in a small compound. Up to now, Lagos State has been the primary state affected, and they have been able to manage this. As cases increase, if they increase, this might be necessary in other places, and we will consider this as the need arises. Thank you.
So the guideline can be produced later on and shared with those who want to know about how self-isolation is carried out. I've said that the first line of defense that we use here is the Port Health Services. I'll ask the Director of Port Health Services to explain what primary screening is and what secondary screening is, and the difference between the two, and when each one will take place, and also why.
Thank you, Honorable Minister. Now, primary screening is done for all arriving passengers. In the process of primary screening, we're carrying out thermal screening. We're looking out for visible signs of illness and signs of communicable diseases. So if anyone who has a temperature of 38 degrees centigrade or above goes into secondary screening. Anyone also observed to be ill-looking or looking unwell goes into secondary screening. And since COVID-19, anyone coming from areas of high burden with symptoms goes into secondary screening. Now, at secondary screening, they're triaged, the temperature is checked again, they're seen by medical staff, and if they fit the criteria, they're transferred to a designated facility. Otherwise, they're sent home on self-isolation depending on what we find. Now, the purpose of this is for early detection and a higher level of containment. So those are the two processes for screening at the airport. Having said that, we are taking it a step further. We now have to verify telephone numbers because of the situation we have had with people giving wrong telephone numbers. We're also now looking at the biodata aspect of the screening forms before the health screening part. In the biodata aspect, we want to be sure that you have given us the correct address. It's not enough to say you live in an estate. We need a road, we need a house number, we need a functional telephone, whether it's at home or abroad. We need to be able to locate you if we need to find you at a time like this. So that is the purpose of screening, and those are the processes for primary and secondary screening.
Next questions. Okay. That's all? Okay, thank you. Now, with regard to the total capacity, well, it depends on what you mean by that. Lagos Isolation Infectious Disease Hospital has 100 standard beds, expandable. The Abuja isolation center, I think, has about 6 or, yeah, less than, about, I think about 12, yes, beds there. But the point is that we have a fallback position in that we have a lot of teaching hospitals and a lot of general hospitals, where we have the medical directors and chief medical directors members of the planning committee, and who have all been told that they should make beds available, and they are all ready for that. They have trained nurses and doctors there, and they can make space available at very short notice if the need arises. As you know, this is the same practice in many other countries of the world, where they now immediately make space available in the hospitals which they have. There's no country that can have all the numbers of beds as isolation centers waiting for you. So you have to have a method of making them available or creating temporary structures, if you like. In China, they have to build 2 hospitals in a very short time. In other places, they have to convert hotels or something into. So these are all steps that you take as fallback positions in case the situation arises, which we really hope we don't need to get to. As for what stage we are in the stage of what we call importation. The disease are just coming as single cases. We are not in the stage of community transmission yet, where it's becoming widespread that people who never even traveled at all are getting it, or people who never traveled at all. So we're in that early stage, and we hope that we keep in that level. That's why we are very focused on contact tracing, on identifying who has been in touch with the index case or the arriving case, and the NCDC is doing a great job here in supporting the states and the public health departments of the states to track and trace. And when it be, we publish the names of people we're looking for if we cannot find them, in order to be able to have the assurance that there is no gap. We also look at the airline that brought the person, if he came in by air, and inform the airline, inform the country, and if any of the passengers have moved to another country, we send a message to them through the World Health Organization that these persons have been in contact with a corona patient on board a flight. As for the strike of resident doctors, my information is that the doctors of the FCT, and we shall be talking to them, joining in talk to them. They actually report to the FCT local government. They don't report to the federal ministry, but we shall be joining in conversation with them. I don't think that that's a good time to go on strike. You do not choose a time when your country is in emergency, and then you create a problem for that. That's not a good thing at all. I think that strike is ill-advised. This is the wrong time, and they do not get any sympathy for choosing a time like this to withdraw services. As for the land border, yes, as I told you, our focus has been on air travel, because we did believe that most of the cases, if they do come here, because this is not an indigenous disease, if they do come here, they will come in by air. But the fact that somebody has been captured to a land border, case has been found there, shows that the vigilance is working, and the individual was identified, and he happens to be a traveler who's moving around, probably trying to. There were 2 of them who are probably trying to go around the world on motorcycles. I think they are adventurers, and so they entered here, and the system was able to identify one of them as positive. The other one is negative for coronavirus, and the needful is being done. We are working closely with immigration services. Yesterday, I had a conversation with the Comptroller General of Customs that we should work closely with them, and work with them, particularly at the land borders where they have control. And we are going to conduct training also for customs and immigration officials on taking temperature and on identifying people who do not look well, and raising their index of suspicion, so that even if at that moment a health official is not there, they can call straight away and say we have a suspect. So that kind of collaboration is done all over the world, and in our case too, we are going to sharpen it. the heads of these two agencies have had conversations with us during the multi-sectoral meeting, and they are very willing to work with us. The ministers supervising the agencies have also expressed great interest and willingness to cooperate with Ministry of Health in order to defend our country and our people against imported disease. Any other questions so that we take all together? Thank you. That's the last. Yes, the National Health Act does leave 5% of the Basic Health Care Provision Fund for emergencies, and this is a fund that normally you access in an emergency like this. But as you know, the Basic Health Care Provision Act, yes, is being reworked at the time, and the National Center for Disease Control has received a good amount of money with which it has procured a lot of things, which is using a lot of equipment to buttress the work they do. And as part of the fund, they're also using in constructing their solution center or equipping it. So the National Center for Disease Control has had access to that amount. But there are also situations where, when you look at the problem you have, you know that that money may not be enough. So the federal government has put forward money, about 1 billion naira that the federal government has put down. We've also had promises of financial support from the Global Fund, country coordinating mechanism. We have had offers of support in cash, also from several foundations and organizations, and we have had even promise of equipment from a certain country in the Middle East that promised to give us a PCR machine for molecular diagnostics. So we have had the promise of support for cash and kind, and I'm sure that if this problem goes even larger than it looks at the moment, people will step up and support their country to face the threat that is imminent. Thank you, everybody.
Thank you.